to Redefining Our Work to Meet 21st Century Challenges webinar hosted by Transforming Communities Technical Assistance Training and Resource Center. To begin today's presentation, I would like to introduce Christopher Watson, National Program Manager for Transforming Communities.
Thank you, Brianne and NCJ-FCJ for making this forum available to host this webinar. Good morning to some and afternoon to others. Thanks a lot for joining us. On behalf of Transforming Communities, Technical Assistance Training and Resource Center, TC-TAT for short, welcome to today's webinar on redefining our work. Today's webinar and slides will be posted on our website, which is www.transformcommunities.org. You can also view the slides right now. If you go to the right side of your screen under PPT file, you can actually download the file right now. I'm Christopher Watson, the National Program Manager with TC-TAT. Also on today's webinar is Donna Garski, TC-TAT's Executive Director. So, as we look to the second slide here, for the past 17 years, Transforming Communities has provided intensive training, technical assistance, and resources to organizations working to end violence against women on a national level, with a special emphasis on prevention work and organizational development. Overall, TC-TAT works to advance new practices, skills, movement building, and policies to prevent violence against women and other related forms of abuse, including domestic violence, sexual assault, teen dating violence, and gender-based bullying. Visit our website for more information and upcoming events. So over the past year, TC-TAT has embarked on a national project funded by the Office on Violence Against Women to offer technical support, training, and resources to organizations in all 21 funded OVW program areas. This project, Grow Forward, is currently working with 23 organizations over the course of a year to create organizational structures and practices that increase our capacity to sustain the future of our organizations. We hosted a 4-day Immersion Institute back in July that brought together all 23 organizations for an intensive 4-day training. TC-TAT is now working with several innovative organizations in the U.S. to host 4 webinars for organizations in all 21 OVW program areas. All 4 webinars are designed based upon your feedback to our national survey conducted back in January. We're excited to offer you more information at the conclusion of this webinar. TC-TAT is honored to be working with Cherie Tang. For the past 15 years, Cherie has worked as a program officer and consultant to the Packard Foundation's Organizational Effectiveness Program. Since 2010, Cherie has also served as a senior advisor to Hewlett Packard's OE grant-making, as well as other incredible organizations doing capacity building. Today's offering will focus on redefining our work. As we look to the future, we face the questions of how to most effectively build on our assets as organizations dedicated to survivor-centered advocacy and social change while navigating reduced funding, increasing demand for services, long-term staff transitions, challenges against the VAW agenda, and more. We hope that this discussion facilitates a reimagining of your work moving forward. We'll also try to answer all questions, as Brianne mentioned earlier, but we may highlight questions that are easier to insert based upon where we are during the conversation. So, without further ado, I'd like to introduce to you Cherie Tang. I will turn the floor over to you, Cherie.
Thank you. Good morning, everyone. I am very honored today to be speaking with all of you to share some of my insights of these years in helping social sector organizations become more effective. You see on screen my family, and today I want to dedicate this webinar to Maya Angelou, all the work that she's done in the world. And I want to start with a quote. She said, "I'd love to see a young girl go out and grab the world by the lapels. Life's a bitch. You've got to go out and kick ass." So I consider us what we're doing and what all of you are doing in the world is kicking some ass so that we can be safe, healthy, and thriving in the world. And I honor the work that you do each and every day. In the next 2 hours on this webinar, we will cover these several things. One is setting direction and strategy for organizations and networks and how it's differentiated from traditional quote-unquote strategic planning processes. Secondly, using ongoing learning and evaluation as a strategic tool at the center of our work. Third, communicating to funders and thinking about our organization network financial sustainability. And fourth is sharing some good practices on using technology. Many of you filled out the survey and gave us really great insights on how you're currently using technology. And I want to be able to use this platform to share some of those with you. And lastly, Coopetition, the future state of, at the same time, at once collaborating with each other and also competing with each other. So those are the elements we will cover today. And when I was preparing for this webinar, TC-TAT principals Christopher and Donna asked me, how do these, how do you see these topics connecting together, right? We're covering these kind of seemingly disparate and, complex ideas. How do we pull them together? And the way I look at it is ongoing strategic thinking about financial sustainability and reviewing those in an ongoing way, integrating smart uses of technology, and thinking about how we as standalone organizations in DV and networks, we're not going to be able to single-handedly change the world. What we need to do is work with each other, crossing sectors and crossing fields of practice. By sector, I mean private, public, and nonprofit, and crossing fields of practice involving people in economic development, in housing, in child welfare, in criminal justice reform. All that is part of the cross-sector collaboration. And they all lead us to more effective organizations and effective networks. So that's where we begin, to look at how these things come together. And as I work with organizations, I use this model. We've got to be clear on the vision of our organizations and networks. We've got to be clear on the mission. What do we exist in this world to do? And then we have to have a superb ass-kicking body of practice, right? The things that we do in the world. We must be able to track our results and tell the difference between our outputs and our outcomes. What difference are we making in the world? And then in the middle of all that, we've got to be able to communicate kind of this top half of this graphic, be able to communicate it so that we can more effectively and able to compete for visibility, for volunteers, board members, for staff members, and for money, for resources and funding. So this is kind of the global kind of spider web, I'll call it, kind of effective integration. So we asked you before the survey, before the webinar, we surveyed you. We asked you, does your organization or network currently have a strategic plan? 66% of you said yes, and 24% of you said no, and 11% said, I don't know. Of the 66% of you who responded yes, to what extent do you currently use it to guide your work? I was really, really pleased to see so many of you in the 4 and the 5 bar. That, 5 is like, yeah, we use it all the time to guide our work. And 1 is, no, it's on the shelf, we got it done, but we don't use it. So I was actually quite impressed to see so many 4s and 5s. And then the 3s are, 32% of you, I would assume you'd say we use it sometimes. So it's like, yeah, kind of, right? And then mostly in the 4s and 5s. So that's fantastic. So strategy and planning. So strategy, I want to emphasize, is ongoing. Strategy is being responsive to opportunities right in front of us and coming up around us. Strategy is knowing and leveraging our core strengths, and strategy is a set of coordinated actions. Right? Strategy is a fancy way of saying we have a bunch of things that we do, and they are coordinated, and we know how they work together, and we know how to leverage the results that come from them. So strategy is not planning. Strategy is not planning. Planning is what, when, who, and how. So strategic planning was something that was developed in the for-profit sector about 25 years ago, right? Many of the big companies use strategic planning. And over time, they have come to abandon their previously adopted ways of strategic planning. Because strategy and planning are two diametrically opposing ideas. So in the old way, planning, you plan and then you implement, and then you plan again, you implement, right? It's pretending the world is about the same. The world stays about the same, and we can predictably say what we think is going to happen in a year, in 2 years, and 3 years. And we know today in these rapidly developing, growing moments of opportunities and challenges, the world is not like that. We cannot just plan and then expect to implement. The current thinking on strategy development is really an ongoing decision-making tool, right, that you use to execute, learn some more, and then you step back from it and say, what have we learned about our environment since the last time we sat together and looked at it, maybe 3 months ago, 6 months ago? What's changed? What's changed about the external environment with funding, with constituent need, with our own organization, with our capacity, from top to bottom and from left to right, right? We use all of that periodic review to inform what are we doing, how can we be doing it better, what are we learning is our core strength, how do we do more of that, and do we have the capacity to do what we say we want to do? So it's an integrated whole. And it's a rapid process rather than every 3 years we're going to do strategic planning, we're going to think together, and then we're going to go implement our plan. And I want to ask you to think about strategy in a pyramid. At the very top of the pyramid, we're looking at organizational strategy or network strategy. Here's where we determine our mission, our vision, the trends that we see, our competitors and our collaborators and partners, and our position in the world, right? Market position is if you think about the word market, it's really about your city, your town, your county, your state, your region. And where is our organization? What do we do well? What are we known for? And then in the middle is a set of programmatic strategies. Those decide on approaches for our programs, and we offer our programs and activities to achieve specific outcomes related to the target audiences. So the constituents, the survivors, the families we work for and with. What program strategies do we best deploy to meet the needs that they're coming to us with? And then all of that is built on the foundation of our organization, our networks, having the requisite operational strategies to support our programs that are aligned with our organizational mission, vision, and the work that we do in the world. So operation strategies are systems, policies, personnel in areas such as finance, human resources, communications, information technology. So I would suggest that when you think about your organizations and your networks, that you think about it in this way, in the pyramid. So some questions you have about operations, some questions that you may have about programs, some questions you have about the overall direction of the organization. Many times these strategy and discussions that we have to have need to be differentiated depending on the time, the place, and what you need to be looking at. I want to suggest that that we use the Q&A box for any questions that come up for us. And please type it in there so that Christopher and I and Brianne can keep track of the questions that are coming up for you. Okay, let me move on. So the first part is I want to go to the organizational identity. At the very top of the pyramid is organizational strategy. Organizational strategy is predicated on our clarity on organizational identity. So in this model, there's A, B, C, D, E, F, G parts of organizational identity. The first part is the business model. So answering the question, who are we in the world? So I basically drew up a kind of a sample responses to these questions. Like our organization, our networks, we exist to prevent and end domestic violence. What do? We provide prevention education, we provide intervention through direct services, we provide advocacy for individual survivors and for systems responses to our individual survivors, because many times the things that we have to advocate for happen over and over again that need systematic responses. We would provide leadership development for survivors and also our allies if we're a network, and we provide healing circles to address sustained trauma in survivors and their families. In the business model, who are we question is where do we work? Geographic boundaries that define where we work and where we do not work. So strategy is as much what we do and what we don't do, and making choices. And then how do we do it? Many times we will provide our services in teams, providing effective operations. We allocate adequate budgets. We have the policies and procedures to guide what we do and how we do it. And we have to fundraise to do what we do in the world. So answering who are we questions really address the business model. And then how do we finance what we do? What does our funding pie look like today? Who should be funding your work? Not who's currently, but who really should be funding your work. And how do we get from the people, our funding pie today, who provides our funding, to where we want to go with our funding sustainability model? So all these questions are essential to answering who are we. And this grid is kind of a sample of when we look at market analysis, market awareness. So there are three horizontal rows that I want to walk you through. The first one is looking at the types of trends, right? First one, social needs or demands for preventing and ending DV programs or services. The direction of this need. Are they increasing, decreasing, or staying about the same, right? Answering these questions every 6 months using your data will give you some evidence-based response to need or demand, increasing, decreasing, staying about the same. And also the types of need and demands will increase or decrease and change. So looking at it more in that complex layers. And comments we have when we analyze the need. Case management and healing trauma services will be high priority. Influencing factors of federal funding and the growing awareness of the prevalence of DV. So those are things that you as an organization or as a network look at and say, as we look at this trend of the social needs or demands, what meaning are we making of the trends? The second row, available funding for DV programs and services. Funding is increasing, decreasing, or staying about the same. And also, who's increasing their funding? Who's decreasing their funding? And what kinds of funding is staying about the same, right? So doing that kind of analysis based on your region, your state, your county. And then answering, putting some analysis behind the data. In our region, we have seen a blank of foundation support, blank of public funding, and a potential for what kind of support or what kind of need for services and programs. In the third row, other trends impacting our organization or network. right? The impending retirement of sector leaders in our region, the need to develop secondary leadership. In the comments, in the meeting, you may think about needing to strengthen our cultural competence in serving a changing demography in our region, or other things that you're observing about trends that are impacting your organization, the way you have to work, the way you have to respond to these rising trends. So again, I would encourage you to use the Q&A box to put in your questions, your comments, your reactions to anything that I'm presenting, so we have a chance to respond. The next part is I want to move on to market analysis and awareness is positioning and competition. And before I go further in this section, I want to talk a little bit about competition. A lot of times in our sector, we don't want to use this word of competition. We compete for, we rather kind of look at it as how do we cooperate so that we can work more effectively, more collaboratively, more effectively. And I totally am of that orientation. At the same time, I do not want to underplay the reality that we do compete. So it is in that collaboration and supportive spirit that I use the word competition, of looking at our position. So how are we positioned in our field or market? So in your specific region, many of you may be the only shelter, the only coalition, the only network. In other places, you may not be. You may be one of many, one of several. So that we need to look at who else is in this field or market. What are they doing? Where are the opportunities for us to work together to leverage and really build on each other's strengths? Where do we stand relative to other players in the field or market? And what are they doing that we're not doing? What are they doing that we could be doing? And what are they offering that complements what we do? So having this analysis of the field and how we got to where our current status relative to others. Is it our chronological age, or is it something special about the niche that we occupy? And where do we want to go within the field or market? Where is it that we see our opportunities? Where is it that we see some of the challenges that we can address together and or separately? So using this way of looking at field and competition and cooperation, defining competitive advantage. So this is one way to define it, right? Nonprofit competitive advantage is a nonprofit's ability to sustainably produce social value using a unique asset, outstanding execution, or both. And I take this from David LaPiana's Strategy Revolution book, which many of these exercises and these concepts come from. And David and I have worked together for a very long time in helping social sector organizations think about strategy and think about where we are relative to others. So some examples of assets or niche advantage. One is that our organization or networks use culturally informed program practices that lead to measurably better outcomes for those historically underserved. Another example, superior integration of direct service and advocacy leadership. Or we have an accessible location, network of locations, or we are co-located with the Family Resource Center or some other co-location that give us that niche. Or we have a great name recognition and reputation among funders and or community allies. Or this powerful partnerships resulting in integrated community referrals and follow-on support we're like the safety net, right? So that's another competitive advantage or niche example. And or a well-connected board of directors who are also enthusiastic brokers of people, knowledge, and money, right? Those are all the resources for an organization: people, knowledge, and funding. So we have a board of directors who are really out there in the community, connected with the community, helping to bring these connections to our agency. And or we're reputed to be a great place to work or great place to volunteer for both staff, for board members, for other volunteer champions in our community. So those are all examples. There are some examples of execution. Like, we're the quickest to respond in crisis situations. We have a faster intervention cycle. Or we have a complete integration of legal intervention with case management. That's also execution. We have better tracking of results or for accountability and public reporting. That's an execution advantage. We have a culturally grounded staff from intake to senior leadership. So when our clients, our constituents walk through the door, they see how they are represented. Their voices are heard and they are visible. That's also a competitive advantage or niche. So in summary, I want to capture it in this grid. And I would suggest that for each of your organizations to be able to articulate that. So components of identity statements on the left, and I have just put in some examples. So we advance our mission of preventing and ending domestic and intimate partner violence, and seek healthier relationships based on mutual respect and understanding by serving individual survivors and families in the name of our county, focusing on the East End or the South End, or where you have geographic focus, through direct intervention, case management, legal advocacy, and outreach. And emphasizing our niche of being grounded in our community's cultures and offering culturally based services. And we are sustainable by a diverse funding stream that consists of public dollars, federal, state, county, city, foundation funding, and individual donors. So I would encourage each of your organizations and networks to be able to fill out the right-hand side of the identity statement responses using the left-hand side components to guide you in thinking through what is your organization identity and how do you articulate that in a very short paragraph. So right here, Brianne, if I could ask you to pull up the first poll. Please answer true or false. Being clear on our organization identity, our mission, who we serve, knowing our place in the market or niche is fundamental to setting strategy. So we have 20 of you filling it out, 27, 34, keep going, 41, 45. Great. We have 52, 58 people filling it out right now. We'd like to see 100% of you fill out this quick survey. So 67 of you have identified 100% this is absolutely true. It is fundamental to setting strategy. Knowing who we are, knowing our place in the market or our niche is fundamental. So 80 of you have said that. And there's a poll question 2, Brianne. Can you pull that up too, please? Program strategies ought to follow organizational strategy. True or false? Or no vote? So please go ahead and click true or false, that program strategies ought to follow organizational strategy. So 50 of you have said it's true. 62 of you have now responded. "72 of you, 73. Yes, yes, yes. That's great. So program strategies definitely ought to follow organizational strategy. Program strategy is the second part of the pyramid. If you recall the pyramid, the top part of the pyramid really talks about organizational strategy. Before you can go to program strategy of what you will provide and how you will provide it really depend on how you answer question number one, which is organizational identity. Setting organizational strategy before you set program strategies is key. Just like anytime I think about a meeting, right, before I design the agenda, I want to ask the question, what is my purpose for this meeting? What are the outcomes I want to create? And then I can go ahead and design the flow, right, the actual agenda itself. So it really follows purpose and then outcome, and then you can design the process. For those of you who are familiar with Rockwood, I'm talking about POP. Right, a quick pop in our conversations, any of our meetings. We can be much clearer about how we want to proceed because we understand what the purpose is and what the outcomes are. Same with strategy. You want to really answer the question about what our organization is about, where are we in the world, what are the trends, and then go on to answer program strategy questions. Great. I don't see any questions or comments posted yet. So if you are thinking of...
Cherie, sorry, I think we actually have a question here from Donna. It says here, it's easier to think about our organization's competitive edge when comparing to non-vault organizations. Could you say a little bit more about how you think organizations in relationship to one another work?
Organizations relating to one another. You mean when we work in collaboration with other organizations?
With other vault organizations, as opposed to looking at our comparison to non-vault organizations.
Oh, yes. So it depends on a few things, right? One is, are you working in the same region and impacting a similar constituent in a similar geographic region? Or are you working separately? So if you're working in the same region and working together, looking at what is it that what the results we're trying to create for our constituents in our region, in our geographic area. What are we doing? How do we refer work to each other or share resources with one another? And what is it that organization A may do really well, and organization B can kind of leverage that, refer to it, and kind of use it? And where is it that we provide very distinct and necessary resources and services? And then how do we share those, either physically or more in a knowledge kind of way? If you don't work in the same region and you are trying to move an advocacy agenda perhaps, or research agenda, or some dissemination strategies, then really looking at what is it that we're trying to do, and what will organization A do that organization B can leverage and refer to, and how is it that we're going to address the results that we're trying to create, and which organization will take which role in addressing it. So in some circles, you can use results-based accountability as a frame, which is what is the population level results we're trying to create, and who is doing what. In some counties, that's also a very effective way of addressing strategy when you have multiple organizations from public sector, private sector, and the nonprofit sector working together. You can also use the results-based accountability framework, which looks at the population level results and who's doing what to move those results together, because we know that on our own we're not going to be able to do it. Any other questions right now that I should be addressing?
There are no
Okay.
questions currently in the pod. Yeah.
Great. Thanks for monitoring those. Let me move on then. In setting strategy, we also use strategy screens, right? It's like the idea of a sieve. That it's a set of criteria to help guide decisions about opportunities, because opportunities are going to come every day and demands are going to come every day, every week, every month. How are you going to decide which ones to do, which ones to take on, which ones not? It's a simple, powerful tool for decision and choice making, which is core to strategy, is choice making. And it evolves over time as you adapt to changes in the environment. And it usually includes 5 to 8 elements. So some examples. That's consistent with mission. It builds on or reinforces our current niche in the market. We'll break even financially or produce a surplus within 12 months or have a dedicated funding stream, right? Some ways that this program or this opportunity is going to be sustainable financially. Or that it's so important that we want to take up that we will use our unrestricted dollars to support it. But somewhere financially, you got to set that as a screen. It will yield results that are sustainable and not fleeting. That may be another strategy screen. Will put us in direct collaboration with an XYZ organization, one that we've been looking to build, right? Some way of working with this organization that we've been thinking about. Or you can consider the following ways of thinking about it. What is this opportunity's value to our mission? Does it pay for itself? Or how does it pay for itself? How does it reinforce our competitive advantage, our place in the market, what we're known for? And do we have the capacity? Does staff have the passion to do this? Does the, if this is something that board members really want to take up, will they be able to participate in the execution, right? Some ways of deciding about capacity. So I would ask you to think about strategy screen as a way to think about your choice making, to help guide your choice making as your organization, as your network evolve. And then in looking at organizational identity and strategy, there are always going to be big questions, right? Here, a number of big questions here to see you. They say they won't leave until they have some answers. So big questions, really framing big question is a strategic challenge understood in context of your organization's mission, environment, and priorities. So for example, how do we respond to the loss of state dollars that we've come to rely on? Can we replace it from other resources? If so, from where? Or will we need to cut expenses? Right, so that's one set of choices. How will the loss of state funds impact DV organizations across the state if we're a network? Is this a temporary setback or beginning of a trend of more cuts? So really anticipating, how should we mobilize our member organizations to mount a coordinated response? So these are examples of big questions. So we looked at the top of the pyramid in terms of organizational strategy. Next week, I'm going to turn to programmatic strategies, where we look at and decide on approaches, offering programs and activities to achieve the specific outcomes related to our target constituents. So key questions to ask about and thinking about program strategies. I am sure you are this just may be a reflex for so many of you, right, in running and working in DV organizations. So what activities should we offer at what scale to effectively pursue our mission within our resource constraints? I think that last part, within our resource constraints, you do not have unlimited resources to do everything. The needs are so great, the demands are so enormous, right? So how do we do what we can at to the best of our ability within our resource constraints and make those choices? Where should these activities be located or delivered? Who specifically should each program target? And how or what approaches, based on what we know about our field, are most likely to maximize our intended impact on survivors and families? So these are all questions that demand choice making, because we do not have unlimited resources, unfortunately, to address all the needs and demands that are in front of us every day. So the what, the where, the who, the how within resource constraints. So in my work with organizations and programs, I will oftentimes use a program logic model or theory of change. Here's a very simplified one that I borrowed from an organization I was working with. So they said assumptions at the core of the cause of domestic violence, intimate partner violence, is the use and abuse of power in an intimate partner setting, made worse by the oppression of women, like systematically, right? And economic, political, physiological, psychological, cultural, spiritual factors. There's no one single factor that is the cause of DV. That's their assumption, right? That guides their political view of the world and why they do what they do. So what are the activities? What do? What are their program strategies, right? They provide case management on a 1 to 20 ratio. They provide 2 healing circles a month. They have legal intervention provision with TROs and custody issues and some immigration. And then they have crisis line with 3 peer counselors and 24/7 on call. Resources that they have, they have an inspiring director and 8 staff on a program operating budget of $900,000 a year. A co-located space within an FRC at below market rent. So this really subsidizes many of their budget. They have an annual gala event to attract volunteers, donors, and visibility on issue of DV. And you see here the annual gala event is not to raise money. It's a friend and visibility raising. And then they capture those friends into fundraising opportunities later. So these are the resources they function with. Outputs. I want to differentiate outputs from outcomes. Excuse me. Outputs. They have 100 survivors and children served a year. 24 healing circles attended by 65 survivors a year, minimum of 4 sessions. 50% of survivors receive legal assistance of some type or another, some long-term, some short-term. And 75% of crisis line callers are successfully referred to at least one other culturally appropriate community-based resource. Their short-term outcomes. Say 40% of survivors report feeling physically safe after 1 year. So they survey their clients, and these are the people who respond. 60% of survivors report children feeling safe after 1 year. 75% survivors who attend healing circles report feeling more empowered and supported after 1 year, and an increase of 8 culturally competent community partners after 1 year. So these are the outcomes they're really shooting for. And then the so what impact question. So each year, 40 survivors are safe and feel more empowered to make decisions for their futures. 60 children are safe and more secure. 100 survivors are more connected to culturally appropriate services based in their communities. So this is a very simple one-page articulation of their program logic model, or they call it theory of change. And then the next one is a different configuration, but it's very similar in the content, right? On the left-hand side, you see their assumptions. And then in the blue box, you see their strategies of helpline, mental health provision, transitional housing, legal, education, and community outreach. And then they have articulated some short-term outcomes. These are immediately after they receive services. In interim outcomes, they define that as 1 year out. Long-term outcomes, they define that as 3 years out, and then their ultimate vision. So what's important for you to see here that I want to emphasize is having a discussion about assumptions. I think is really important for an organization, right? We can all do what we do in the world every day. But are we operating on similar assumptions about what's in the world, what are the trends, and why things are happening in our communities? And then a set of coordinated actions called strategies. What are they? And then short-term outcomes. You can define those as 1 year, 3 years, or immediately after you serve them. Whatever it is, the important thing is you agree on the time frame, and that you agree on the interim outcomes time frame, and you agree on the long-term outcomes, and that these are realistic and tangible. At the same time, push the organization to stretch somewhat beyond your comfort zone. And then articulating your long-term vision for you as an organization, as a network, for your clients individually, the survivors and their families, and for your communities.
We have a question
Any
here.
questions
Sure.
coming up?
Yeah, we do actually. So we have a question here from Donna. It says, could you say more about best practices for making hard choices based upon resource constraints? This is hard for many organizations in the movement because a lot of the survivors face life and death situations who need our help. Many of us overextend ourselves because of the urgency of the need.
Yes, that is absolutely true. And I think the first thing is to accept the fact that we can't do everything, that we must make choices as an organization so that we can preserve ourselves to be able to go for the long haul, right? I want to see every single one of you on this call, the people you work with in your organizations, the volunteers that you have, to be able to sustain their service over a lifetime and not just for a year or 2 years, and that we're all holding our breaths and working ourselves into a place where we are only functioning on 50% or 40% or lower, right? In our energy, in our spirit. So choice making is really, really, really hard. There's no easy answer to choice making. Choice making is really a important, vital, essential capacity that we have to develop. I'm sure when you counsel your clients, your survivors, there are things that they must attend to first. And then they can attend to other things, right? You would probably, hopefully not advise them to handle 10 things all at once. You would advise them to handle 1 or 2 things, and then they can get to the third and the fourth thing. That's the same for our organizations. We must know what those first, second, third things are. And to be able to say, long term, what is it that's going to keep our organization, our services vital, so that we don't run ourselves so ragged that we're only providing mediocre services. That's 1. 2 is, how do we preserve ourselves, our strengths, our spirit, so that we can go for the long haul? Because many, many more survivors will need us. Third is then to say, do we want to provide deep services to a target population? And then hopefully have the ability in our community to provide for those that we cannot serve ourselves. So that really challenges us to be in community with others, be in alliance with other organizations. And is that serving fewer people more deeply? Or is it serving more people in more emergency intervention modality and referring to other organizations for the deeper, more long-term healing? I think those are the choices that we have to make. And there's just no easy answer to that. Donna, I would also invite you to share your wisdom along the way on the seminar as well. You've worked with many organizations and have had many, many decades of service in the DV field. Any other questions that I should be responding to right now, Christopher?
That seems to be all that are on the table right now, but I believe we have Donna unmuted now, so if she has any ideas or recommendations, she can definitely feel free to jump in.
Thank you.
Well, Cherie, just to add to
Yeah,
the
please.
points that you've already made, I think that, everything that you mapped out sounds like the right way to think about it. I just wanted to highlight this particular point because I think there's an emotional aspect to the challenge of setting priorities and in some situations setting limits. And I know that from my experience working with violence against women organizations that I think one of the things that I've noticed from my own direct experience in organization and with others is that we hold not only the responsibility to respond to the problem, but also the analysis of what it means to be working in a survivor-defined, survivor-centered modality. And I think many of us hold a concern about, if we're not the ones providing that, sensitive, smart-minded advocacy work, where's it going to happen? And who's going to be doing it, if anyone? And so it's a struggle. I'm not to say that I have more to add to it, but just to acknowledge, I think that there are some unique aspects that we face as a movement when we think of others coming on board to do the work and or sharing the work with others, because a lot of what we struggle with are systems and other providers that don't carry or are fully informed about the analysis and the advocacy work.
Thanks for that, Donna. That's absolutely right. I think the advocacy, the collective advocacy of our organizations in our regions, our counties, our state is so crucial to moving the needle for survivors and their families in all types of abuse and violent situations. And how do we get us to work together in that sense to move our common agenda forward? So I would liken that to in our counseling, right? What resources do survivors have, and how do you draw upon those resources to help us through this rough patch? And looking at our organization and our resources in that same way. In our region, who's working on what, and how do we get them to take on the issues of domestic violence, intimate partner violence, sexual assault.
Right. Yes, and I think maybe there is a question, again, going back to the theme we're talking about today as far as meeting the challenges of the 21st century, that perhaps, I know one of the things that we've had to look at in the organization that I'm with right now is, perhaps what we need to do is to invest more in this systems work, in training others within systems to do, survivor-centered work so that the load is shared more broadly within our community, because clearly our organization alone doesn't have the capacity to meet the increasing demands around the services. And so that's where I think this whole point you made earlier in the webinar here is like, how do we see ourselves at that organizational level? And, are we here as a part of our mission to build community capacity? Sometimes we talk about it in terms of community ownership for the problem, but I think, to me, community ownership is connected to community capacity. And, that is a strategy. It's a strategy to build more capacity so that the burden of responsibility at the service level isn't just on the shoulders of whether it's a sexual assault organization or domestic violence or some other version of an organization working on violence against women issues.
Right. That's right. So adopting a movement frame to a lot of our work will help us, I think, both long-term, looking at success when violence is no longer tolerated and when violence is taken on as a community public health issue, and no longer just on the shoulders of DV organizations or networks.
And I would just
So,
say that, Cherie, just let me add one thing here.
yeah.
I'd be very interested in hearing chat feedback from all of you good-minded folks out there today who are with us as participants to see to what extent what we're talking about right now resonates with your experience. If this is one of the issues that you're struggling with in your organizations about this capacity of the organization to respond at the direct service level, and then this idea of building more systems capacity or community capacity. I'd be interested in your thoughts about that particular point. I'm done, Cherie.
Great, thanks. Please continue to share with the whole group. I'm going to segue now to learning and evaluation as a strategic tool. This, to me, is one of the two things that's really underused in our sector, learning and evaluation and coaching. So today I'm only going to talk about learning and evaluation. So it's really a cycle, right? Measuring effectiveness of our activities. Like, are they working? And helping us be accountable to our community, to our funders, to ourselves, to our constituents. Are we meeting our goals? How well are we progressing along the lines of our logic model of theory of change? How well are we doing? What program development improvements do we want to do? Using evaluation to document our work. If we don't tell our story, somebody else is going to tell our story. So I want to encourage us to think about using learning and evaluation as a tool to document and tell our stories of our work. And also speak on behalf of the hundreds and thousands of sexual violence survivors. We want to use learning and evaluation to inform the field for replication, for adaptation. We want to use learning and evaluation to help us plan. What are we learning about what works? And what are we learning about what doesn't work? And how will we integrate that into our programs through a planning process? Building organizational capacity. What do we know about what our client and our constituents' experiences are to help us reflect on our organizational capacity. Communicating our success, right? If you remember the spider that I showed, communications is in the middle, right? That grabs onto the top part of the clarity of organizational identity and the bottom part, right, of having to compete for resources and visibility and all that. Learning and evaluation is a tool to communicate the work that we do in the world. And most importantly for me is a time to reflect for our insights, right? Everyone can have experiences, but the ones that are those of us who reflect on those experiences, right, that's where the wisdom comes. That's where the awakening comes. So learning and evaluation as a strategic tool. We surveyed you on does your organization network currently evaluate your work as an ongoing learning activity. I was so happy and pleased to see that 65% of you who responded to the survey said yes. I would love to see that number go up to 75% if we do this webinar a year from now, and then 85% to use this tool as an ongoing learning activity. And then for those of you who said yes, we asked what is it that you do? So 43% of you say you survey your client, stakeholders, customers on a yearly basis or more frequently. That is fantastic. We've had a third-party external evaluation conducted within the last 3 years. Only 12% of you who responded to the survey said yes to this. We occasionally, less than once a year, ask and or survey our client, customer, stakeholders on how they experience us, 24%. And we conduct other types of evaluation to inform our work, 21% of you said you do that. So taken as a whole, I would say these are really, really good, encouraging signs that you, at least you all in this cohort who responded to the survey, are using evaluation and learning as a tool to inform your organization. So typical approach, right? We're focused on measurement. Evaluation is a specialist responsibility. Evaluation is a discrete outsourced function. Evaluation is at the final stage of a program. Evaluation lives kind of on the margins of our organization or networks. Whereas I really want to invite you to think about this evolving approach, that evaluation is really focused on inquiry. So think of evaluation as learning, right? If you take away the pejorative or negative connotations of being evaluated, being judged, having somebody outside coming in and anthropologically studying what you do, none of that. It's about inquiry. It's about learning. And evaluation is a leader's responsibility. It's all of our responsibility. Think about evaluation. The answering the so what question at least 3 times, like so what we do this, and then what? And then what happens to the survivors and their families? And evaluation is an ongoing collective responsibility of our program staff, of our volunteers, of our board, of our leaders, of our senior leaders. And evaluation at every stage of the program, not only when it's done, when it's finally, the CDC grant has run out and we're required to do an evaluation, right? Evaluation's integrated every stage because we need to learn about what works. And evaluation and thinking evaluatively at the center of everything that we do. Every morning I get up, I think about, at the end of today, what do I need to have accomplished, right? That's evaluative thinking. Thinking about your organizations. We do case management. We provide this many services. Think about, okay, what is the outcome that I want with each survivor and each family? Beyond just what we can deliver, the service, like what's the impact you want to have on their lives? What, a year from now, what do you want to see? Like taking evaluation at the center of everything that we do. And let's see, it's a catch-22. It's hard to divert resources to train and increase community capacity when there's overwhelming need, and yet we don't have assistance in meeting that need if we don't do the work to build community capacity. So community capacity is a catch-22, and I would say it's very similar to evaluation, right? A lot of times we're so engrossed and immersed in responding to crisis intervention that we don't think about evaluation, and because we don't have time, we don't have the resources to devote to it. We don't train our staff. We don't have the IT systems to set up to track the data. Right? I would ask you this. What's the price we're paying for not doing that? What is the price we pay as a community, as a movement, as an organization, as a network, when we don't track the results of what we do? And are we willing to continue to pay that price, right, for us? And a lot of organizations sometimes will ask me, can you come help us fundraise? And I would say, well, what are the results you've created in the world? Right? You can't just ask for funding without being able to articulate, this is the impact we have in the world. And evaluation is a tool to help us do that. So before we go on to financial sustainability, let's pull up the poll, the instant poll, Brianne. I think I have one on evaluation. Oh, no, not this one. Is there another poll question, or was that the end? Okay, so let's see. Which one is output? I want you to tell me, A, 4,586 crisis lines called answered by a 24-hour crisis intervention. 251 restraining orders were obtained by our attorneys. 211 youth participated in our teen dating violence prevention education. None of the above, all of the above, or no vote. Which one is output? So I'm just going to wait another 3 seconds. Great. So 91-ish, yeah, 92% of you said all of the above. You're absolutely right. Those are all outputs. So there's a next instant poll question on evaluation. Which one is result or impact? A, of the 1,301 survivors who received services, 40% report feeling safe. 75% of children survivor survey respondents said they felt more empowered as a result of attending healing circles. 90% of survivors after 1 year of case management intervention said they're now at a better place than before. None of the above, all of the above, or no vote. So let me just take another 5 seconds. Please respond to one of these. All right, 100% of you said all of the above. You're absolutely right. So recently I received a postcard for a fundraising appeal from a DV organization. And they gave me all outputs, right, of the numbers, how many they served, you know, how many TROs, how many this, how many that. And I had to ask myself, okay, you did all that. And what happened? So what? Like, are people safer? Do people feel more empowered? Are they more healed? Right? I want to know the so what. So when you all make fundraising appeals or provide program reports, I would love for you to be able to articulate outputs and outcome. Outputs and outcome. So activities of what you're doing and the so what. Because you've done those activities, so what? What's different in the world? And now I want to move on to financial sustainability. So financial sustainability we can probably talk about for like 3 days all by itself, but I'm going to spend a few minutes to touch on it. So some things I want to offer. Financial sustainability is an orientation, not a destination. There is not a time when we will be permanently financially sustainable. There will be no such time. I'm sorry to disappoint you. There will be no such time. Unless you had, I guess, a $10 billion endowment investment by, you know, some very rich tycoon. Well, when that's not happening to, you know, most of us, it's an orientation. And the first thing we need to know is we have to know our true cost. Like, what does it cost to provide these services? And then the third thing is who should be funding our work? To answer that question, who should be funding our work? And then lastly, how diverse is our funding pie? So these 4 pieces of this cycle are, each piece is essential to answering the financial sustainability question for our organization. And we need to be visiting this on an ongoing basis, just like organizational strategy. It's part of being responsible stewards of our organization. And financial sustainability is not the responsibility of the executive director alone. It is not the responsibility of the development director. Financial sustainability thinking is the responsibility of every single person in every single organization, no matter what position, what you do. Got to be thinking about, so are we thinking about financial sustainability? Is it an orientation or do we treat it as a destination? Do we know our true cost? Do we know how much it costs to run a program? And do we know what the associated outputs and outcomes are? And have we thought about who should be funding this work? And are we giving them the opportunity to fund our work? Are we making the ask? So who should be, not necessarily just who is funding our work, or who are the parties, but who should be. And then looking at our pie. How diverse is our funding pie? When we surveyed you, communicating to funders and financial sustainability, we asked you, does your organization currently have a business plan that spells out your financial sustainability model? Only 19% of you said yes, who responded to the survey, not everyone on the call. And 44% of you said, no, we don't. And 37% of you said, I don't know. So when I looked at this pie, I was a little, I had a reaction that says, okay, we need to spend more time on this, right? That it's not enough to just treat this as somebody else's job. Each of us have a responsibility to think about financial sustainability and to ask this question, even though it may not be our job. Our job may be to answer the crisis line. Our job may be to, direct the legal advocacy program. But we have a responsibility to think about financial sustainability. And for those of you who said, yes, we do have a business plan that spells out a financial sustainability model, almost 50% of you use it constantly, right, as in a 5. And then 24% of you rated it a 4. That's really good. That means when you have it, you use it. And a business plan really is about the funding model for your organization. So, you can call it, whatever your funding model, a funding guide, a funding strategy, a financial sustainability strategy, whatever you call it. It's about looking at the financial sustainability reality currently and futuristically. And 34% of us don't know our organization's business plan. I would challenge all of you, if you don't know, that you need to know. That you need to help think about it, you need to help craft it, you need to raise the question within our organizations, what is our financial sustainability model? And to be able to bring that into your organizations with a sense of inspiration and vision, that we need to have one. We need to have this conversation. So this is taken from Jan Masaoka and Jean Bell's recent work on mission impact financial sustainability. They wrote a book, which is at the last slide. All the resources that I'm using for this webinar is there. I suggest you take a look at this. It's a very simple but powerful model, right? On the horizontal axis is profitability. So really in the nonprofit sector, we're talking about, are we losing money or are we having a surplus, right? It's not like profits that we pocket, it's surplus. Like, are we breaking even? If we're breaking even, we're at the middle of the intersection. And the vertical axis is impact, right? Some programs have less impact than others. And impact is defined by your own theory of change and logic model, not defined by anyone else. So in this very simple, powerful grid, they have, okay, if it's profitable, right, it pays for itself, and it has high impact, is the star. We invest in those programs and we grow it. If it doesn't result in a surplus, and it does not pay for itself, but has high impact, is our heart, right? We want to keep those, but we must contain the cost. We must know what it costs and how much are we losing so that we can plow other resources into it, or we can go on a Kickstarter or crowdsource fundraising model and keep it, sustain it. If it does not pay for itself and it has little or no impact relative to our theory of change, our vision, our mission, we should stop those, close it, or give it away. And it may be a legacy program. It may be programs that we've done for a long, long, long time. If it's not financially viable, those programs really need to be examined seriously, and the possibility of closing it or giving it away. And then the ones on the bottom right are the ones that we call like money tree programs, right? They help us make money so that we can plow the money into other programs that we love and has higher impact, but these programs may have lesser impact, but they make money. Making money meaning they create a surplus that we can plow into the heart programs. So this is a model that I find is very simple to use, and in their book, they actually walk you through how you can conduct this exercise within the organization, and it's a very powerful exercise to conduct. It's a sobering look in the mirror financially, and I think many of us intuitively kind of have a feel for this, and the power comes from a collective articulation within the organization, from top to from the board to volunteers and everyone in between, filling out a survey that really talks about where we're at, that's supported by a financial analysis that will help us make decisions. So I've worked in foundations.
Cherie,
Yeah.
This is Donna. Before you go on, I have a couple of probing questions I'd like to ask on this financial sustainability piece. Are you going to be talking about that?
Please.
More? Okay. So could you give me an example of what a financial sustainability model looks like or what it sounds like? Because I'm not clear about this. So
Yes.
The model, yes. So if you could please respond to that.
Yeah. So so looking back at the, say, I'm going to just use this grid to walk us through. So say for this organization that looked at their strategies, right? Helpline. How many people are they serving? How many staff they have? How much does this program cost? And how much money are we raising to support the helpline, right? Dedicated strands of funding. When we look at mental health counseling, the small groups, the trauma healing circles, how many are we running? How many people are we serving? How many staff it requires? How much money does it cost? And who is funding this work? So every one of these programs doing that examination, right, of knowing true cost, of knowing our funding streams, and then mapping it with our evaluation data, hopefully, and mapping it on this grid of impact and profitability right here.
Okay.
Is then you will get to know which program fits where, right? Some will be in the heart area that's really high impact because we know client experience and what happens to them, right? A year out, 3 years out. We know how much it costs, and we know that we are able to fund it at, say, 70%. So we have to raise 30% of it. So it's just a very hard look at what it costs and using evaluation data to say, well, how much impact is this program having? And then looking at what monies are we able to fund, are we able to raise to fund it? And then you map it on this grid of profitability and impact. And then you say, okay, some of our programs that we really love in this heart grid, but we need to raise another $220,000, right? It gives you data of how much money you actually need to raise because you want to keep these programs, because they're so vital, and how do you know they're so vital? Not just because we just love it year after year, we think it's great, but our survivors, our clients, our families, our partners tell us that these programs are indispensable, right? Then you go, and this is an opportunity to go to them and say, the data tells us this is one of our biggest impact programs, but year after year we are running in a deficit. Will you help us with $5, $10, $100? We need to raise $200,000 this year to sustain it, right? So it gives you that kind of evidence, the data. It gives you the ability to tell the story and communicate the need, and it gives you the opportunity to take this to the community so that they own this, right? The community ownership and individual donors, right? I believe that the sooner we embark on grassroots fundraising, the further ahead we will be. The later we start, the later we are in the game of individual donors. I think the days of institutional funding and 100% reliance on institutional funding, those days are, I don't want to say they're over, but they're hard. You know, they're going to be over one day. And they're dangerous for our organization. They're really dangerous, because what if one or two or three of those funders decide they don't want to fund this anymore? Their boards have decided, you know, they've been funding DV or sexual violence prevention education for 10 years and they're done. They want to move on to something else. Then what's going to happen? Right, so we need that diverse pie, and we need to know which programs are in the heart, in the star, in the stop, and in the money tree quadrants.
Okay, and that was really helpful. I think there's another question that's emerged here, so let me ask it since we're right on this financial conversation. So one of our participants, Lucy Pope, wrote, how does a program temper this with shift in funders' priorities that may not match our hearts?
Absolutely, absolutely. I think that is exactly where we need to know, do we have programs in the money tree, water and harvest, increase impact, or not, or just water and harvest, right? And how do we plow those surplus into the heart? So that's one way of doing it. Second way is, they're not all exclusive. I think that there's multiple ways. Another is to look at, so how much money are we running in deficit? You got to know that. You got to know that by knowing your true cost, and to know how much money you got to raise. I think relying on funders, like institutional funders, like foundations, is a dangerous road. I think that's a short-term strategy. Midterm, long-term, we got to have more of other ways of funding our work. Individual donors. I think, you know, that it's tempting to think that our survivors don't have money. They may not right now in the crisis moment, but at some future they will. And are we asking them to give back to a program that has helped them through a rough patch in their lives? Are we asking them to volunteer with their capacity, with their volunteer hours and their heart? Are we asking them for that $10 a month sustainer? What if we had $10 a month from 50% of everyone we have ever served? That will solve it. But we got to start that now. We got to start that with our thinking, and we got to start that with our approach, and we got to start on that individual donor giving program. The sooner we start, the further ahead we will be. And there will be programs that are not going to be funded by institutional funders, that they will be fickle, and that's a reality, and they will move on.
So one thing, that was a really helpful elaboration on that, Cherie. And just one other point is just an acknowledgement about this point about funding is so fickle. And, you know, I would say that most of us on this phone call here today, if we've been funded by the Office of Violence Against Women, At best, we're usually at a 2-year funding cycle, and then we have to go through the reapplication, and we never know. And so when I think of financial sustainability, it's like sometimes the definition of that for me is like we made it through this year. We're sustainable for the year, when in fact
That's
it
right.
really it should be something that is more long term. But
Yes.
we're also living in an environment where funders, we've worked very hard to change public policy to get federal state funding, and yet we live on these very short funding cycles. And so there's just an acknowledgement that sometimes it's hard to see fully into the future when so many of the variables we have little control over.
Absolutely, absolutely right. And I think that's where we need to work systematically as a movement to change the system, to advocate for system change. I mean, the Army or the Navy, they don't have to go, on a 2-year funding cycle. I don't think they do. And I mean, so advocacy for funding that is not based on a 2-year cycle for our organizations, I think that's definitely a public policy campaign for our organizations, for our movement, long term. And short term is we got to be thinking about other ways of financially funding our work that is not so just tenuously dependent on a single source. So I think those are key. Someone also wrote, the program financial sustainability analysis is complicated by the reality that some funding sources may be specific to intention but potentially apply to more than one program. I suppose this problem, quote-unquote problem, is addressed through organizational prioritization, or is there a relevant best practice? Some funding sources may be specific to intention but potentially apply to more than one program. Donna, do you have an insight on this?
Let's see, I suppose a problem. Well, maybe again, I'm not sure this is the correct interpretation here, but that the funding crosses over to 2 programs, and those programs may be evaluated differently within the framework that you just presented here, but that it's from one funder. So you might decide to divest the program because the evaluation results suggest it's not strong, but that funding is tied to that particular unit. I think that's what that question means. And is there a relevant best practice to deal with that?
Recently, I was on an evaluation. Yeah, maybe Catherine can elaborate a little bit while I think about this a little. I was on an evaluation webinar with Michael Quinn Patton, who has written probably most of the textbooks on evaluation, and he railed against best practice. And I just want to share that a little bit with what I heard he say. Best practice assumes that all conditions are exactly the same, right, in organization A, B, C, D, and your environments are exactly the same, your resources are exactly the same, your communities are exactly the same, so therefore you can apply best practice. So what he encouraged us to think about is that there is no such thing as best practice. What works for one organization cannot just be replicated by another organization. There's got to be some adaptation based on context, based on demographics, based on community history, organizational capacity. So I think at best we can say these are good practice for this organization that we can learn from. And under those conditions, these things work for them. Right? How do we learn from and adapt those to our own organization? So let's not pretend that there's a formula that we can just apply, but that we have to make sure they correspond with our organizational context. So here's Catherine's additional this is relevant to plotting the impact profitability of programs. Our state funds, for instance, can fund hotline or shelter. We decide where the funds go and where we may have need for additional funds. Yes, yes, yes. You can totally map your profitability impact and specific programs and then say, okay, well, these 2 programs are jointly funded by this state resource. hotline is here and shelter is here. So regardless of funding source, the organization internally, I think you have to be clear on how much is allocated to hotline, how much is allocated to shelter, and where do we think shelters plot on the heart, stop, star money tree, and where shelter plot, so that you can strategically decide, well, the demands are increasing, decreasing, this is our impact, and this is where we want to allocate the dollars. So really, the funding source may be specific to these two programs, and when you map them, you will see where they are in terms of your organizational priorities. And you can map this and nobody could see it. I mean, it's certainly very private, right, for each organization. So knowing this as leaders in your organizations, it's a tool to help you make decisions. It's a great question. Thank you. So let me move on. 5 things I've learned from working in and with foundations. So this was a really good practice for me. I've been working in and with foundations for probably 16 years. I probably have worked with 20 foundations, both small family foundations, community foundations, large private foundations like the Packard Foundation. So these are some things I've learned. Relationships matter. Funders fund people. That these relationships need to be cultivated just like any other relationships. And, be authentic. Funders are just people like us. They're not another species. They have feelings, they have history, they have, their own inspirations. So be authentic, be yourself. Second thing I've learned is outputs are not the same as results. Most funders really want to know the results you're creating in the world. Outputs are good, outputs are important, activities are great, they are very much needed and they're important. Stretch beyond the outputs. Articulate the results you're creating in the world. And with what evidence, right? So using learning and evaluation, however you do it, but do it. 3 is ask for what it takes to produce the results you want, not what you think you can get from the funder. I think at this point, we, as a sector, don't do enough. We don't know our true cost. We don't know what it takes to produce the results we want, so that we shrink, we shirk, and we play small, and we ask for what we think we can get, rather than what we know it takes to create the result we want to create and the results that the funders want us to create. So the core of this is knowing the true cost and going for it. They may not give it to you, but at least you've put it out there and you know what it costs. And when the funding is cut by 25%, 50%, then you gotta, calibrate your activities and the impact. The 4th thing is funders know each other. So you can ask them for introductions, to host a funders briefing, to serve on your boards, not necessarily your governing board, but your advisory board, your councils, whatever, something where you involve them in their thinking. You can ask them to review your financial sustainability model, to read your strategic plan, to give you input. When you do community survey, include them. When you have something breaking, some news, share with them. Stay on their radar. Don't just talk to them when it's time for funding renewals. Like I would say every 6 to 8 weeks, send them a note saying, hey, the last, month, this is some things that happened. Give them a story of a survivor and the family that you are providing service for. Help them stay in the loop for that relationship, for that authenticity. And the 5th thing is funders need you. We need each other. If there were no nonprofits, if there were no issues, we would not have a need for funders in the world. So it really boils down to this, according, this quote from Martin Luther King Jr., that all life is interrelated. We are all caught in an inescapable network of mutuality, tied into a single garment of destiny. Whatever affects one directly affects all indirectly. And what you do affects the funders. And know that, right? Approach them with confidence that without you and without what you do, there's no need for them, right? So it's not the other way around. It's not, they don't, you don't necessarily need them to be in the world. It's nice to have them in the world, right? So that you have more resources to address all the needs. But you don't need them in the same way they need you. So approach it that way, with confidence, with power, and knowing that you are doing the work that they don't do. Funders exist to give money, right? That's their core business. And they need nonprofit organizations. So I think approaching it that way and staying on their radar, stay in the loop, and be authentic with them, cultivate those relationships, ask them for input, not just at funding times, will help you navigate these relationships. I'm going to keep going here. It's, and I want to talk about good practices on using technology. This is from Beth Cantor, who's one of my greatest mentors and teachers in using social media. So be and do. This is her kind of suggestion of a frame, right? Understand networks. Create social culture, listen, engage, and build relationships, trust through transparency. And do, what do? We work with crowds, we have learning loops, we friending to funding, right, making friends, and governing through networks. So this is all evolution using technology and social media. Defining a social culture uses social media to engage people inside, outside, to improve programs, services, or reach communication goals, right? We are essentially social animals. So this is how most of our organizations are and moving to used to be, is we have staff, we have institution, and we pretend, right, that's how we move to our goal. I think in a movement building frame, it's lots of institutions, lots of organizations working together towards our goal. And 2.0 and moving into the future is staff in and out of organizations, in and out of our networks, bring them into and with each other is how we move towards our goal. So social change 2.0 requires us to think in terms of systems, requires us to visualize, requires us to map our networks and know our networks, that if we inquire based on assets. We have collective strategy setting sessions and direction setting sessions. We have technology enhanced connectivity. So it requires having both hard skills, like the technology, network mapping, analytic tools, strategic thinking, understanding of complexity and dynamic systems. Those are all hard skills. And the soft skills, right? Group dynamic, crossing boundaries, ability to create alignment, build relationships, network, connect people, conflict resolution. Those are all the current and future realities of how we move a social change agenda. So, of course, the first time would be a bit scary, taking our stuff onto the social media and onto using technology. And I want to share some of the things that came out of the survey. Christopher, can you help me with this? Let's see, where is that?
About the use of technology?
Yeah, use of technology. I just had it this morning. I'm sorry, I have it, okay. So we asked you, what is one example of how you're currently using technology successfully to strengthen our work? I was really inspired by all the responses that we got. I'm just going to read off some of them. Using social media to reach community, website, Facebook, etc., computers to communicate by email, lots of grant writing research online for programming. Using Eventbrite and MailChimp to reach our supporters. You have an online database and use Facebook for outreach. Activate our community through email and social media. You have a live, somebody said we have a live answer 24-hour crisis line. Our crisis line cell phones have texting capabilities to communicate with service participants who prefer text-based communication. Additionally, we are actively researching online and text-based crisis intervention models, as well as technology-based counseling services rather than traditional face-to-face. That's great. We have a Facebook page, a victim services website. We're creating a comprehensive survivor website exploring blogging, Twitter, and the use of hashtags. We have YouTube videos of our recent flash mob, Palm Beach County SART flash map view from the front. There's a YouTube site for that. That's so inspiring that you're using these new technologies to do that. And more quotes. Our membership is statewide, so we only meet in person quarterly. I'm currently using GoToMeeting for telephone committee meetings on a monthly basis. Another wrote, online training, disaster recovery, and financial documents on cloud, extensive agency-wide client database. That's fantastic. Another one wrote, tracking records, gathering information, keeping up to date with new information, creating tools. Another one said, we created a DV community website to have a single calendar of events and training. Another one said, social media campaigns, web page postings on both to raise community awareness. So it gives you a sense of all the things you're currently doing. One of you said we utilize HMIS database to run all our quarterly reports we submit to our funders, as well as our quality indicators for all of our programs. The use of technology has strengthened our delivery of services and quality. Someone else wrote, we use Microsoft Outlook on an ongoing basis to communicate between departments as well as to network with community partners. Someone said, we use an online database for our shelter so we can pull reports for our contractor forms. Just a couple more. We use the database to capture all client demographics and activities as well as metric outcomes. We have a database that analyzes our phone call volume and call trends. We have developed a web-based referral system for law enforcement. We use social media and websites for outreach. I think all of these are so inspiring, and that you are using technology to augment and strengthen your work and your effectiveness. Right on. So I'm going to move on to Coopetition. Coopetition, the future state of collaboration and competition, right? It's a merger of those two words. We asked you, have you applied for funding as a member of a coalition? 46%, so almost half of you who responded to the survey said yes. So this is really an important part, right, of our current reality as well as our future. And I want you to reflect on how social is your organization's culture? Between very and not at all, right? Somewhere in between. Where are you? Like it or not, Coopetition is what is. So building cross-sector alliances, that we bring people who are the unusual allies into the work that we do, right? That it requires us to have nimble collaborations that focus on results, relationships, that help us all be more resilient to the constant changes and demands that we face. And I want to offer this as essential elements of nimble collaborations, right? We move anywhere from cooperation to coordination to collaboration, right? This is not a judgment of anything is better than the other. It's a continuum, right? In vision and relationships, in structures, responsibility and communication, authority and accountability, resource and rewards, right, down the vertical column on the left, right? Those are the elements that I would ask you to pay attention to no matter what kind of collaboration networks that you're working in. Pay attention to those four. And this grid gives you some idea of what's required in each stage of the collaboration, from cooperation, coordination, collaboration. So 10 principles of resilient collaborations. If we were in a room together, this is where I'm going to ask you to just call it out and name it. So somewhere it's going to appear here. Leadership energetically supports the collaboration's purpose. This is principle number 1. The leadership of your organization or your network enthusiastically, energetically supports the purpose. There's equity of organizational power. So really recognizing that not all organizations in the collaborations are the same in size or influence or history or legacy or competency or power, right? Recognizing that. Systems are adapted continuously. So this is the systems and procedures of the collaboration itself. So in the earlier grid, it would be structures, accountability, communications. That leadership is shared to the extent appropriate. Leadership is shared. And conflict is expected and is managed effectively, right? I think we've all had our stories of collaborations that have failed because there were existing conflicts that were not addressed and not managed effectively, and it takes time. Transparent, not another layer of bureaucracy to our organizations, but it helps our organizations do our work more effectively. That's why we're in these collaborations, both formal and informal, right? Decision making is transparent. How are we going to make decisions? Who's going to do what? Where's the money going to come from, right? A big part of things that tear down collaborations is that, power is concentrated in one person, two people, and decision-making, funding not being transparent. Each agency, each partner in the collaboration is accountable to its own leadership and constituents. Decision-making is delegated to appropriate subgroups that, all roads do not lead to one decision maker or two. Right, it's delegated to appropriate subgroups, and they bring back their decisions to the whole. Collaborations are usually impermanent, that they exist for a purpose and then they can disband, that you don't need to keep them just to keep them. And documentation supports resilience. Documentation, not verbatim, but important decisions. Let's see if we have any questions. Okay, so I'm going to do a quick review and wrap up. Setting strategy, it's setting direction, and strategy is differentiated from traditional strategic planning processes. There's strategy and there's planning, right? Using ongoing learning and evaluation as a strategic tool. Communicating to funders and financial sustainability, we got to know, right, true costs. We got to know HEART, STAR, Money Tree, and HEART, and there was a fourth quadrant. We've got to know where our programs fit. We've got to communicate to funders, stay on their radar. We've got to keep embracing, accepting the use of technology and helping each other succeed on using technology. Christopher just said that there's a hashtag, redefining our work, and that we can use that to find each other's tweets. Coopetition, the future state, the current state of collaboration and competition is not going to go away, and to use it deliberately, judiciously, and that they don't have to last forever, right, the collaborations that we're in. And everything we've covered today, cross-sector, nimble collaboration, smart uses of technology and social media, financial sustainability review, ongoing strategic thinking, all lead to us having strong, effective organizations. That's the goal of this webinar. And the mission, vision, body of practice, tracking results are the essential elements, right? And that all feeds into what we communicate to garner, foster visibility, volunteer staff, members, and funding and money. So the 5 resources I used today, Nonprofit Strategy Revolution by David LaPiana. It's a workbook, easy to use. I see some of you have used it. You referenced it in your survey as well as the chat today. Nonprofit Sustainability, where the Sustainability Impact Profitability Grid comes from, Jean Bell, Jan Masoka, and Steve Zimmerman. BethKantor.org. If you are not subscribed to her, I really encourage you to subscribe to her blog. Mobilizing Generation 2.0 by Ben Rigby. It's really about using effective uses of social media. And then Karen Ray's book on nimble collaboration. So I turn it back over to you, Christopher and Donna.
Cool. Thanks a lot, Cherie. I'd like to welcome Donna back into the conversation to offer a few reflections.
Sure. Thank you, Cherie, as well as Christopher. I just have a few things to share that sort of stood out for me as I've made notes going through this webinar. And going back to the beginning part of the webinar when Cherie talked about strategy development, and one of the things that I learned there was the importance of, in that conversation about strategy, is using it also as a time to define what it is we don't do. I, in my mind, often think strategy development is about everything towards the future, but hadn't factored in using it as an opportunity to also sort of own what it is we don't do. As I noted in my comments section in the chat, I thought this piece on the market awareness and analysis to factor in trends and changes in leadership, that is a particular area of concern here in the Bay Area, where it's anticipated that some of our seasoned senior leaders will be rotating out in the next few years, and I thought that was important that that was acknowledged in that section. Under the part about the leading edge collaboration and cooperation, I was inspired to think about what it would mean for, in particular, I work with domestic violence organizations in the Bay Area through a collaboration, but for us to use that tool and the thinking that you offered us, Cherie, to talk about our model for the Bay Area region as 19 different shelter programs in terms of what it is we provide and how we see ourselves more from that sort of balcony view as organizations in a particular region. So that really stood out for me as something I want to follow up on. And I thought the power of this point you made about, I found it very powerful about evaluation. If we don't tell our story, someone else will. And that evaluation information gives us an increased capacity to tell our story with a unique kind of power. And the emphasis that you placed on the results versus outcomes. I just recently read an article that talked about the future trends of younger donors, and that those younger donors coming into our system, and by younger here I mean in their 30s, early 30s, they're more interested in results than sort of what the organization does. And that I think all of us have faced the challenges in working with funders wanting to see more at the results level. I hadn't learned yet that that was also emerging as a trend with younger donors, hopefully many of them to be our future donors going forward. So I see some urgency around this outcome piece in particular. And then just in closing, I want to say that I think to be mindful of the changing and emerging body of information about what is social change and what it requires as far as what you talked about as far as the hard skills and also the soft skills. And at the end of the day, I think it's really powerful for us to remember that our work is about social change, and that in addition to everything we need to know about as trends changing in the nonprofit going forward, I think it's important also to learn more about how this notion of social change is also, as a body of knowledge, is also evolving. So I really appreciated that you added that to the presentation today. And I know we're going to run out of time here if I don't stop, so I'll turn it back over to you, Christopher.
Cool. Thanks, Donna. So unfortunately, folks, we are out of time. So thank you for joining us for today's webinar. We'd like to thank the Office on Violence Against Women for their support in funding this project, and the National Council of Juvenile and Family Court Justices for partnering with us to host this particular webinar today. But before you go, we ask that you take just a few moments to fill out a survey evaluation. The link will actually appear at the conclusion of this webinar. So your feedback is super important, and we use it to shape future webinars and training. So thank you in advance for completing that evaluation. We also want to remind you that we have an upcoming webinar that's scheduled for Tuesday, July 15th at 10 a.m. Pacific time. And this webinar, which is called Doing Different with Less, 3 Tools, will provide participants with an engaging and interactive session designed to increase their knowledge of 3 particular tools to help participants navigate complexity and community change through organizational eco-cycle, the collective impact framework, and community engagement. So this is open to all OVW-funded organizations. So to find out more, just be on the lookout for an announcement at the same place that you heard about this particular webinar. Or you can also visit our website, which is, again, www.transformcommunities.org, and I'll go ahead and put that up here. Oh, there it is, already up on the screen. So you can also see our archives of webinars that we have, and that's at the web address that's there at the bottom. So finally, thank you once again to Cherie for the great information, and please, folks, don't forget to fill out a webinar at the conclusion, an evaluation at the conclusion of this webinar, and it'll pop up immediately after the webinar. So thank you very much.